Hello, Inform Scotland followers and friends, it's me again. I just now updated the informscotland.uk website and updated it with the excess deaths data, which were updated in turn on the National Records for Scotland website yesterday. They're always updated on a Thursday. And I hadn't done them for a couple of weeks. I was quite shocked at what I saw in the data. I've been speaking to somebody else about it and he was saying about how upsetting he found it. It's kind of like the lockdown skeptic's nightmare. All the things that we've been warning about, all the things that we've been lamenting that have been taken away from people, all the structures that normally keep people safe, the healthcare, the GP appointments, the schools, people's work, mental health services, just all of these things which have been disrupted, they keep us alive. Now, I'm not claiming that any one of those things in particular is causing this excess in deaths. What I'm saying is we have dealt ourselves a massive blow, and nobody in a position of power has ever done a risk-benefit analysis to lockdown and all the COVID restrictions that we've put in place. And now, of course, we're giving people a medical therapy, which has some worrying safety data associated with it. We don't know from the trials of this treatment what the long-term safety data would have looked like, but I think we're starting to see it come out now. And deaths are really, really high. So in week 40, which is the last week of 2021, we have seen an excess death of 315, which is about 30%. Since 1974, and possibly beyond that, that's as far back as my data go, we have not had more deaths in week 40 of any year. So it has been truly exceptional, and I think it's so exceptional I'm actually going to put another post up just about that. But this post here, we're trying to zone in on like causes of death and locations of death so that we can try and get a handle on what's going on. So this is the very grim graph. That's excess deaths compared to the 5-year average. The blue line is 2020 and the red line is 2021. Now, we have had 20 consecutive weeks of excess death and the trend is upwards. We have had no significant period of a deficit in deaths. You can see the first wave very clearly on the excess deaths. That's exactly what should happen in an epidemic, or what you would expect. I mean, epidemics in an ideal world would never happen, but they do happen. So we had this wave of illness which led to a lot of excess death. Now, I have my own theories about what made that so extreme, but there it is, and it's very clear. There's no getting away from it. We saw enormous excess death in 2020 in the spring. Look at when waves 2 and 3 hit though, and you see, sorry if I didn't throw my laptop around so much. You can see in waves 2 and 3, we don't have anything like as much excess death. Now, what that suggests is that yes, we saw COVID cases, we know we did, we saw a lot of COVID cases, and in fact, we've seen more COVID cases in wave 5, which is barely visible at all, really, on the excess deaths. There's no peak visible. But yet we saw a peak here. This excess deaths number is actually higher than it was the peak of the coronavirus wave in the autumn last year. This trend is only going up. Is it conceivable that it's going to go back down over the winter? I think not, I'm afraid. I don't see any signal for that whatsoever. So that's the first level of insight, which just made me feel really, really sad. And like I said, my nightmares are coming true, that all of the restrictions, the mask wearing possibly to a certain extent, which I believe is not very healthy for people's lungs, and also this way out strategy of the pandemic, I think all of these chickens are coming home to roost. We are certainly not looking good for a 90% vaccinated population coming out of an epidemic. We should see a deficit in deaths this year, really, because we had a big epidemic in 2020. The vulnerable people were infected. You can see that it's an incredibly fast-spreading infection. So why have all the vulnerable people not been touched yet? Why are we not seeing a deficit as those people who are vulnerable are taken out of the population? They are killed by the virus, which is very sad, but that is what happens because we don't live in an ideal world where there's never any viruses. You should see a deficit in deaths following an excess, but we have not had any deficit in deaths through 2020 or 2021. This is not what an epidemic looks like. Unless the excess deaths in 2020 were as a result of a previous deficit, in which case that makes your pandemic look less severe. These are just numbers. This is the reality of the situation that we're in, and I'm not putting forward any one theory as the absolute correct one. I'm just saying what the possibilities are. This green curve, this graph's 2020 and this one's 2021. You can see in this graph that excess deaths, which is the blue line, were closely matched to COVID deaths in 2020. Now, it's actually quite a complex picture, but let's say that COVID accounted for all the excess last year, just for the sake of simplicity and to follow the government line. Well, what's happening in 2021 then? So in 2021, first of all, COVID deaths exceeded excess deaths, which implies that there was at least some misattribution going on, or something had happened to suppress people's susceptibility to other causes of death, which seems strange because I don't see how that could have happened, but maybe that is the explanation. But then about halfway through the year, suddenly excess deaths have taken over from COVID deaths as as a bigger cause. And so what that tells you is that now other causes of death are kicking in, not related to COVID, unless we are not as keenly attributing COVID as a cause of death. Again, I'm not saying which one I think is the case. I'm saying these are the possibilities, and you may form your own view or find another explanation if you can, and comment on the video and we'll have a think about it. Excess deaths by cause from 2020 to 2021 is presented here. Now the blue dotted line is the overall deaths from all causes. You can see that ramping up and up and up of excess deaths, and you can see that COVID is the biggest cause of excess death, but of course all COVID deaths are excess deaths because we've never had COVID before 2019, and that's where the average is taken from 2015 to 2019. You can see that other causes of death are now kicking in as well. Okay, so we've had a deficit of respiratory deaths, for example, but that's coming back up to a more normal level. And the other deaths are kind of hovering around that zero line, but the scale is a bit poor on there. In fact, I'm going to go and add a zoomed in graph which will show 2021 because I'm not very happy about that graph overall. Graph 5 shows deaths by location. Now, I have just put in care homes, home, non-institution, and hospitals. So the red line is homes. You can see that deaths in the home have been elevated for some time, but they're pretty consistent. actually. And that what happened was in 2020, lots of people were moved out of hospital and started dying at home instead. Yellow is the hospitals deaths, and they have been low after the winter wave of COVID, but they're now coming back up again. And a lot of those deaths must be COVID deaths, because COVID deaths are most commonly happening in the hospital. What is really interesting about that graph is the blue trace, which is care homes. Now you can see a huge and sudden increase in excess deaths in care homes. So we're talking about 50, which is really, really significant. 60 excess deaths in care homes in the last week. Now, we saw a similar rise in care home deaths in week 53. So, sorry, it's a bit confusing. That's the red trace now. In week 53, you can see that we saw a big spike in care home deaths, very similar to what we're seeing now. I notice that we have started boosters in care homes, and the rise in deaths that we saw in care homes in week 53 of 2020 also coincided with the rollout of the vaccine. Obviously, those two things cannot be related when one is thinking correctly. However, the correlation is starting to be quite striking, and it requires some fixed thinking, fixed and inflexible thinking, not to come to the conclusion that those two things might be somewhat related. People have been worried about cancer deaths. That graph's a bit messy, sorry, but if you just look at the blue line, you see that we have had quite a lot of excess cancer deaths recently, but it's not unusual. Cancer deaths do fluctuate, certainly not unusual when you look at the last 2 years or since the start of 2020. What is noticeable though is that the blue line is hovering over the zero line of excess more now than it has in the past. And so I think we are seeing a bit of a signal with cancer deaths. COVID deaths by setting 2020 into 2021 are shown in this graph here. And what you can see is that in the latest waves, there's an awful lot more COVID deaths happening in hospital than in care homes. Maybe that's an indication of the vaccine working, because all those care home residents have been vaccinated. So actually, that is an interesting sign. But of course, you have to bear in mind that we saw increased deaths in care homes after vaccine rollout. So they sort of cancel one another out, you would think. You're seeing a little bit more COVID deaths happening in the home and in care homes there, but still the vast majority of them are happening in the hospital. There's no good news here. It's a complex picture. But if you were thinking that lockdown would reduce COVID deaths, and that after we'd locked down and vaccinated a lot of people, our death rate would come down, you're going to be sorely mistaken. If the cause of these excess deaths that we're seeing now, this huge number of excess deaths that we're seeing now, is related to things which are now baked in, so a lack of healthcare, disruption to services since 2020, then we are going to see large excess death numbers for a long time. And this is precisely what those of us who've been speaking out against lockdown have been concerned about. And I just think it's really, really sad that we haven't followed our previous pandemic advice, which was to keep life as normal as possible, and that you can't vaccinate your way out of a pandemic. These were, if I'd said those two things, you shouldn't lock down your healthy population and you can't vaccinate your way out of a pandemic in 2019, everybody would have nodded along and said, yeah, that's exactly right. That's exactly what it says in the pandemic management playbook. But for some reason, we've gone another way. And I do believe, from what I know, that there has never been a more catastrophic exit from a pandemic than this. We've still got loads of COVID around. Our hospitals are still struggling to cope. We have huge excess deaths, and we're about to embark on much more vaccination now, because that worked so well the first time. Yesterday I was cranky, and today I'm feeling a bit blue and depressed. I know that I have plenty of company though, and I ask you to stay tuned, stay sane, stay strong, and remember, I love you.